Well, thank you very much, Chairman Winstrup, and thank you to the witnesses for testifying before the Select Subcommittee today. And I'm going to dovetail a little bit on what my colleagues just said. Today being the last scheduled hearing for the Select Subcommittee, this is my 4th year on this Select Subcommittee. I'd like to take a moment to thank Dr. Winstrup and his staff for their incredible leadership throughout this Congress on investigating and evaluating the federal government's response to the COVID-19 pandemic. Under his direction, we have held key agencies and witnesses accountable for their actions made during the pandemic, fulfilling the Oversight and Accountability Committee's mission to provide a check and balance on the role and power of Washington and a voice to the people it serves. I'm really proud of the work that we have done, and I look forward to another productive hearing. And most importantly, the majority of us on this committee understood that our mission was, in fact, to prepare for the next pandemic. And so what has been brought up by Dr. Winstrup and Dr. Bera is precisely that. I spent 24 years in the military, as well as a practicing nurse, doctor, former director of the Iowa Department of Public Health. And if we don't look back on what we did and do an after-action report, we don't know how to build upon what has gone before, what our errors were. Dr. Walke, you're the director of the Office of Readiness and Response at the CDC, where you support the agency's effort to improve performance for public health emergencies. And as you likely know, as I just stated, I was the director of the Department of Public Health, and I was a practicing physician before, after, and then prior to coming to Congress. And I thank Dr. Bera for his comments about origins. Yes, we spent a lot of time on origins, but even in 2020 as a freshman congressperson, when the media and social media was trying to portray this as a witch hunt and it was useless, my comments in 2021 are the same as they are today. It was necessary to investigate origins because that's how we prepare for the next pandemic. We need to discuss immediate disclosure, which the Chinese Communist Party did not do and are required to do under international law. We need to discuss lab safety, what type of laboratory research occurs in what lab environments, and that it's in the correct lab environment. And number 3, we need to discuss the ethics of certain types of research, i.e. gain-of-function research. So that's why those were important issues. And my next question is going along this line on how people were treated who engaged in conversations, not conformity of thought. During the COVID-19 pandemic, I administered vaccines to Iowans in all 24 counties in my district, but never supported any sort of vaccine mandate or vaccine passport, and that's because I'm a physician first. I was and still am critical of the CDC's messaging surrounding vaccines during the pandemic, largely because it inserted itself between the doctor-patient relationship and it discouraged patients from asking questions. It downplayed and, in fact, refuted that there was infection-acquired immunity and herd immunity. People were labeled as anti-vaxxers, radicals, and called other demeaning terms simply for questioning whether novel vaccines that had not been FDA approved were right for them, or if they needed to be vaccinated if they'd already had proven disease and immunity, or if because of their age, and we saw 2 of the vaccine experts at the FDA resign over the FDA's position. So as a result, we've seen increased rates of vaccine hesitancy, which could have a detrimental impact on public health, especially as we're entering flu season. In most of my district, for example, rates of vaccine hesitancy are already at 15%, and as a state senator in 2019 and 2020, I can tell you there were numerous bills entered and discussed about prohibiting vaccines. So do you believe that the CDC's, I'll call it forceful to be diplomatic, guidance on COVID-19 vaccines and lack of detailed information on possible adverse outcomes, like when they downplay that there was myocarditis in young men, that it's contributed to the increasing rates of vaccine hesitancy?
Thank you for the question. COVID vaccines have really undergone the most rigorous safety monitoring of any vaccine in history. And
I'm sorry. Please don't do that. Please don't do that. I'm asking you, how is the CDC going to overcome increasing vaccine hesitancy? And talking to people about the most rigorous scientific protocol for COVID-19 vaccines is not going to end that hesitancy. They have people they talk to in their community. They have young people who have myocarditis. We have people who were kicked out of the military because they declined to get a vaccine when they didn't need it. I even was advised, even though I had strong antibodies, to get the booster. And I'm a physician. And asking the physician, why in the world would you recommend this when you just tested my antibodies? The purpose of vaccines is to confer immunity. So what is the CDC doing on vaccine hesitancy? Have you worked with outside stakeholders and providers? And how are you going to meaningfully reduce vaccine hesitancy?
We are working with a number of different external groups to try to improve trust and try to overcome vaccine hesitancy. Vaccines are incredibly effective and the best defense. We also believe that CDC makes recommendations for the general public, but that relationship between the provider and the patient is incredibly important to interpret that recommendation from a public health agency.
I would
like
wholeheartedly
CDC.
agree, which is what the CDC should have done and how they should have messaged during the vaccine, to leave that between the doctor and patient. With that, I yield back. Thank you.